Hello, my name is Gabrielle Wages, and I am going to be giving a presentation on nurse aid and nurse burnout. First, we're going to discuss what exactly is burnout syndrome. Burnout syndrome is a work-related constellation of symptoms that usually occurs in individuals who have had no prior history of psychological or psychiatric disorders. It is triggered by a discrepancy between the expectations and ideals of the employee and the actual requirements of the position. Symptoms of burnout syndrome are chronic fatigue, insomnia, forgetfulness and impaired concentration, physical symptoms, increased illness, loss of appetite, anxiety, and depression. These can be caused by various factors, but a relevant factor is time spent at work. In a study provided by mededwebs.com, nurses who worked 12-hour shifts had reported higher stress levels than nurses who worked 8-hour shifts. This is a direct correlation to the increase of nurses and nurse aides needed in the healthcare field. If the shortage is so high as it is now, nurses and nurse aides have been overwhelmingly required to work longer shifts, which increases burnout. Nurse aides and nurses who are also new into the healthcare field have a high chance of burnout as well. Ways to prevent and treat burnout. Nurse burnout directly impacts patient satisfaction. So, we need to keep this in mind in ways to prevent and treat burnout. Because of the fact that the main reason we are all nurses and nurse aides is because we love our patients. To know that burnout may cause a dissatisfaction to our patients is important. Organizations are making steps to approach this problem by measuring nurse wellness. An example would be carrying out regular surveys that monitor their well-being. These questionnaires measure stress level and overall satisfaction of the position. Other ways to treat burnout are focus groups and regular reviewing of the employee. Sources used in this APA presentation are psychologytoday.com, Burnout Among Nurses by Jay Spinks, Nurse Burnout and Patient Satisfaction from www.nichi.gov/articles. Thank you very much for listening to this presentation.